We're ready? Okay. Good afternoon. County Executive Rich Fitzgerald here, doing our weekly briefing at the Health Department with Director Dr. Deborah Bogan. I'm going to start off, you see me wearing my mask, and I'm going to certainly take it off to do the presentation. And I know we've gotten a number of requests after we've been talking these last couple of weeks about urging people to wear their mask, saying, does the county executive wear his mask? We don't see him wearing his mask. Well, I can tell you that I do wear my mask. You know, when I walk down from the courthouse to the health department building, I wear it. When I walk back, I wear it. When I'm on my street where I live, I wear it. When I go to the store, I wear it. I haven't had very many meetings, in-person meetings, with a lot of Zoom meetings and Microsoft Teams meetings, but I have not had very many in-person meetings. But even those in-person meetings where people do come into the courthouse, I do wear the masks. You also probably see me do a number of interviews over the last couple of months in which you don't see me wearing the mask. But what you don't see is I wear the mask to the interview. I take it off so that people can see. There are people obviously that lip read, things like that. And I'm going to list some of the folks that have done in-person interviews, and they could probably confirm this. Marcy Cipriani, Dave Kaplan, Aaron Martin, Renee Wallace, Andy Sheehan, John Shumway, Bob Bowder, Caitlin Sykes, Brittany Hope, Kylie Walker, Michelle Knoll, and Jillian Hartman. I apologize if I miss anybody. I'm trying to remember over the last 3 months. And I know we've done, say, on Fridays when we went into the yellow or we went into the green or when we didn't, we would do the interviews and we would talk about them, and I would wear the mask and then take it off. So I am not asking people to do something that I'm not willing to do myself, that my wife isn't doing, that my own family isn't doing. It is really important because as we see our numbers go up, and we did a briefing on Monday. I think it's the first briefing we've done outside of our normal Wednesday briefings because we went up to 45. Today we had another 45. These are two high numbers that we haven't seen over the last, really over the last 2 months. So it is concerning, and Dr. Bogan's going to talk a little more in detail about what we're seeing and what we've got to continue to do. We want this economy to be open. We want people to be able to get out and do things, but to do it safely. And to do it safely is really wearing the mask, physical distancing, washing the hands, the things that we've been learning over these last number of months. So we know it's inconvenient. We know it's not fun to wear it. We know it's much easier to not, especially if it's hot. But the fact is, we're all in this together. We've talked about this from the very beginning. When we did back in mid-March, when Dr. Bogan and I in the park talked about shutting things down and being safe, how great Pittsburgh does when we come together. Well, we talk about coming together by staying apart. That doesn't mean you can't go out. That doesn't mean we don't want people to go to our parks, go to restaurants, go to all the various things that we like to do, but we want to do it in a very, very safe manner. We see a lot of these tests that are being positive are young people. And we hear people say, well, young people aren't as vulnerable. Young people will be able to, brush it off and be fine. But the fact is, in many cases, that may be the case, but not in every case. But also, young people also have the ability to spread it, and they have the ability to infect others. And the fact is, 1 out of 5 of our residents in Allegheny County are over the age of 65. So we're all in this together. We just can't isolate the 20-year-olds from the 60-year-olds. We all have grandparents, we have parents, we have aunts, we have uncles, co-workers, people that we come in contact with. So it's really important for us to continue to work together to do all the things we know we can do in a good way. And Dr. Bogan's going to talk about that. We've seen some results. UPMC made some statements today about young people with COVID-19. Again, their testing and our testing are showing that it is a lot of young people. But again, we're all in this together. We talk about, I want to make sure I get this right, hashtag all4one together, so that we all continue to do the things that we know we need to do as we move forward. So let's continue to do the responsible things we know we can do, following Dr. Bogan and Secretary Levine and Dr. Fauci, at the federal, state, local level. These folks are there to protect us, and if we follow their advice, we'll continue to move forward in a very positive way. So let me bring Dr. Bogan up to give a talk about what she has seen over the last couple of days.
Thank you, Rich, and good afternoon. As I said on Monday, we are keeping a very close eye on new cases of COVID-19 and the related hospitalizations. So what do we know about the new cases? Well, the new cases continue to be among young people in their 20s, 30s, and 40s. Of the 45 new cases reported today, 28, or nearly 2/3, were among people 19 to 49. Some contracted the virus from a family member, but really most don't know where they got it. Several of the new cases reported that they had recently traveled out of state. And although we've seen sort of very small clusters, mostly in families, in general, we're not aware of any large clusters being identified from any particular events, restaurants, or anything. What does this mean? It means that we have community spread of COVID-19, the virus that causes COVID-19 in our community. And at least some of this is likely coming from people who don't know that they're infected and they're spreading the virus to others. And I want to remind people that about 40% of people who do have the virus have no symptoms. So I've also heard from people that they think the coronavirus is like the common cold, so it's no big deal, you'll get over it. Well, that is true for many people, that it's a minor illness, but that's not true for everyone. Here are some facts about COVID-19. The death rate from COVID-19 is much, much, much higher than from influenza. In Pennsylvania last year, about 100 people died from influenza, while more than 6,000 residents of Pennsylvania have died in just 3.5 months from COVID-19. More than 100,000 people in the US have died from COVID-19, and that is more than all of those who died serving our country in Vietnam and Korea combined. Those most at risk of dying are the elderly, those with a compromised immune system, and those with chronic health conditions. And today we reported 5 new deaths. These deaths were added when the state updated its database. The people who died were aged 71 to 96. All were residents of long-term care facilities, and they died between June 14th and June 22nd. And we are also seeing a slow increase in the hospitalizations. And sadly, we expect that to rise. Hospitalizations are a really good way for us to assess the severity of the outbreak, and they lag behind cases by a week or more. So again, as we're seeing these rises in the last few days, we expect the hospitalizations to go up over the next week or two. So, like Rich said, I'm asking everyone to consider how their actions impact others when they make choices. A few things that you can all do. You can limit how much you go out. We did that in the past. Again, we can continue to do that. I'm not saying we have to all stay home all the time, but think, is this trip really necessary? And when you do go out, be careful. Keep your distance from people, stay outside when possible, wash your hands or use hand sanitizer often, and please wear your mask. I've heard from people that masks don't work. That is just not true. Masks do work if worn properly over the nose and mouth. Masks stop the droplets that can contain the coronavirus from spreading to other people and to the people nearby you. So people should wear their masks whenever they're inside a business, whether it's a grocery store, a corner store, you're at mechanics or a bank, I don't really care, you're out and about, please wear your mask. And if you're going to a restaurant, you can take off your mask once you're seated, but wear it, for instance, if you get up to go to the bathroom at the restaurant. If you're drinking with friends at a bar and not wearing a mask, keep in mind that droplets are spreading when people talk, laugh, sing, shout, so it's best to keep your distance from other people as best you can to limit your exposure. So employees at all businesses, including restaurants, need to wear their masks. We've seen a high number of new cases in the last few days, and we'd like to see those start to drop again. But if the number of new cases continues to increase, we are prepared, and we're better prepared than we were back in March when this all started in Allegheny County. We have more personal protective equipment, we have more testing available, the testing is better, it's more accurate, and the results are coming back faster. But remember, please stay at home if you have any symptoms of illness, to be abundantly precautious, and please get tested because we do have the capacity now to test people with any symptoms. In addition, our hospitals have experience treating the virus and keeping it contained. And at our health department, our case investigation and contact tracing teams continue to work, and they're ready. We've added people to both teams recently, and we'll add more if we need to do that. We have currently about 10 people conducting case investigations and 15 doing contact tracing. This includes new health department employees hired specifically for this pandemic and medical students lending a valuable hand and getting some real-world public health experience in return, and members of our Medical Reserve Corps who are volunteering their time. Between June 4th and June 17th, the latest days for which we have complete data for our case investigation, our case investigators have opened 160 new cases. And so far this month, our contact tracing team has reached out to about 150 individuals or households identified as close contacts of those cases. And we've been able to reach nearly 90% of those close contacts, and we've advised them on quarantine to reduce the spread of the virus. So I just want to pause and say that we've focused a lot on numbers recently. How many new cases? What's our positivity rate? Are the daily numbers of tests going up or down? And these numbers are important, and I know you all want to hear them. And they give us the picture of how the virus is spreading in our community. But really, the numbers aren't the whole picture. The numbers really miss the personal and human side of this pandemic. They don't begin to describe the grandparents, the mothers, fathers, brothers, sisters, friends that we've lost and become sick. The numbers don't show the families worried about their loved ones in hospitals and long-term care facilities. They don't capture the strain caused by lost jobs, closed daycares, and financial insecurity. So I just want to remind you about the personal side of this pandemic. And I've relied on the best science I can find as I helped us navigate through this pandemic. But I've also relied on my heart. Each new death hurts, each new hospitalization worries me, and each new case is a concern. And we're in this together. We've been in it together since the start. Please stay home if you're sick. Wash your hands, keep your distance from other people, wear your masks. These are steps we take not just to protect ourselves, but really to protect everyone else. So we focused on numbers a lot, but really it's the people who really matter in this. And I'd like you all to stay safe and be kind. Thank you.
A number of the questions are likely ones that you touched on, but I'm going to go ahead and ask them again anyway. I apologize. The first question is from the Tribune Review. We see that the county has reported 45 new COVID cases today, as well as both an increase in deaths and hospitalizations. Does the county health department have anything to say about the increase in numbers and why that increase might be happening?
I think I did really address that pretty thoroughly in my comments. It's happening because we've opened up and people are going out and they're traveling and they're, I think we have asymptomatic spread in our community, so you don't know who's sick and who's well. And so people just need to be vigilant and realize that the only way to really prevent the spread is to do the things we've talked about, because we don't yet have a treatment. I mean, we have some treatment for hospitalized individuals, but we don't have a definitive treatment, and we certainly don't have a vaccine at this point.
You've spoken about recent contact tracing, but can you tell us if contact tracing is being done with every case?
Yes, contact tracing is being done with every case. And from throughout our county, I want to say, is fairly unique in that we never gave up. Even on our peak day when we had cases in the 70s, our epidemiology team was vigilant and did case investigation and contact tracing for every case since we've started this pandemic.
This question is from WPXI. At previous news conferences, Dr. Bogan has stated only about 3% of the county has been exposed to COVID-19. Does that make this jump in cases more concerning since there's been so little exposure?
Yeah, I think the cases are concerning, right? Our goal here is to really limit the number of people who get sick until we have definitive treatment or immunizations.
This question is from KDKA. Is the county going to implement tighter restrictions on businesses due to rising cases?
You want to answer that?
I guess, well, yeah. This is one of those things that it's not exactly a yes or a no. It's really on a case-by-case basis, and I think Dr. Bogan and her team obviously do certain inspections under certain circumstances. Restaurant inspections probably coming most to mind. We are hoping that everybody is following CDC and Department of Health, state and local guidelines, and that's what we're asking people to do. So if you are a business owner, all of your employees should be wearing their masks, physically distancing, all those kind of things that we've talked about. certainly when you have a lot of public interaction, where it's a retail establishment, a restaurant, a bar, those type of things, again, it might make it a little more challenging, but we're really asking people to continue to follow that. And I think you will see, you know, as these numbers go up and we get reports from folks who are reporting things about certain establishments, that there probably will be some guidance, some informational sessions, things like that. So we're hoping, again, I've used this analogy a lot, smoking. You know, we don't actually go out and really write tickets for people that are smoking in places they shouldn't be smoking, but the public in general becomes the ones who kind of regulate that and keep people from doing that. We're asking people to do the same thing. When you're not wearing that mask and the breathing and the virus goes out into the public, you're infecting the rest of the community. And that's what we're asking people to really follow the guidelines that Dr. Bogan and her team have talked about. We've been really good about this for the last three months, a little over three and a half months now, and we want to continue that. So we're just asking people to be cooperative. It's not about a police state, but it's really about all of us working together.
This question is from WESA. Dr. Bogan, today UPMC's Dr. Don Yealy said that the recent increase in infections is not necessarily a bad thing because most of the people who are getting ill with COVID-19 are younger and healthier and less likely to be hospitalized or die. Yealy says the most people who become ill and recover from COVID-19, the higher the community's level of immunity, which is a good thing. However, you've noted that only about 3% of the county's population has been exposed to the virus. So do you share Dr. Yealy's view that this increase in cases helps Allegheny County?
So herd immunity is a really important concept that we rely on, and one of the reasons we vaccinate and try to vaccinate at high numbers. But we know that really for herd immunity to have really any effect in our community, you have to have at least 60% of people who are immune, either through natural immunity by having had the infection or through immunization. So we are far from that. And the problem with increasing numbers, even among our young people, is that as you get more and more cases like they had in New York City, even young people have succumbed to COVID-19. And so it's sort of an odds game, right? The more people who get it, the more you get the rare outcome of a bad outcome. And so the importance for me is that we really limit the spread, because as Rich talked about earlier, you know, we often live in multi-generational homes. We go to places of work with many generations of people from young to old. And if 40% of people can spread the virus without having any symptoms, they're going to spread it to people who are at risk. So as the health director, what I really want to say is my goal is to keep the number of infections really low until we have both a good treatment and an immunization that can protect our entire community.
There are two related questions, one from the Tribune Review and one from WESA. Do you know when the people who are included in today's numbers were tested? Is it possible that today's 45 new cases are due to a backlog of any type?
Really is not due to a backlog. Always our tests each day reflect testing sometime in the last week, and that's true of the 45 today, of the 19 yesterday, the 45, they really are from about the last week. But we are not getting test results from 2 or 3 weeks ago. These really reflect tests from the last week.
This question is from WPXI. Given the new cases announced over the last 3 days, are you anticipating higher case numbers for the foreseeable future?
I don't know. I'm worried that could be the case, and we're planning for that, but time will tell, right? Yesterday we had 19, we had 45, then we had 19, then we had 45. So it depends how many people are going out and getting tested, and how quickly those results come back.
This follow-up question is, do you know why the people who were reported as positives today were being tested? Were they symptomatic, close contacts? Do we have information like that?
I really don't have that information at hand, and we're happy to get back to you on that.
This question is from Kitty K. A source says the local COVID spike isn't from demonstrations, but a few bars and restaurants, as well as people coming back from Jersey and the Carolinas, and high school graduates who went for Beach Week. Is there anything you can say about that?
Yes. That's, people have reported all of those kinds of things. But again, that is not true of all of the cases. Some cases really don't know where they've gotten it. So some have been from travel, some have been probably from being out in bars. But again, it's not like people can say it was this particular event or location. And we certainly haven't seen a hot spot or any place where multiple people have gotten sick at the same or gotten it from the same location.
This question is for both Dr. Bogan and County Executive Fitzgerald from Public Source. What do you make of the bid by County Council to secure COVID testing for all county employees? Is this something that either of you would support?
Start since I'm here at the podium. No, I don't really support that. Mass testing for that kind of a group really, I don't think, again, it's just one point in time. And so what do? You test them today, but people aren't symptomatic. So I'll give you an example. UPMC has been giving us the numbers when they test people who are not symptomatic and don't have a reason to be tested other than they're going in for a procedure. And their test results have shown that less than 1% of those people actually have COVID-19. So that's a similar thing you were asking. If we tested every employee at one particular time in the county, I would suspect we'd get similar numbers, right? So I'm not sure how that would be useful at this. And again, then you test them again a week later. So no, I'm not. I think our current testing strategy is really the way to go, which is if you have symptoms, you should get tested. If you have a known exposure, you should get tested. If you think you were out in a mass crowd and you could have gotten infected, you should get tested. But again, that testing should be timed to about 5 to 7 days after you think that exposure happened. So testing the entire group all at one time just doesn't work well with my thinking of testing.
Yeah, and throughout this pandemic, what I've been wanting to do and continue to do is follow the advice of experts like Dr. Bogan, Secretary Levine, the CDC, Dr. Fauci. I know the county manager working with the 6,500 county employees. As Dr. Bogan said, when symptoms occur, if somebody's got some symptoms or even asymptomatic, but they've been in contact with folks, they've traveled, they've been in an area where there has been, then that testing will occur. So to be done on a case-by-case basis is what continues to happen. We've seen that particularly in our canes. There have been much more testing that have gone on in our 4 cane facilities around the county that has happened. So we're going to continue to follow good, sound medical advice and not, if you've seen me over my years, we don't really respond to people who like to grandstand. And I'm hopeful that we get people that want to continue to do responsible medical policies, and that's what we're going to continue to follow.
County Executive Fitzgerald, this next one's for you as well. I apologize. This is from the Pittsburgh Business Times. Have there been warnings or certifications to businesses over COVID-19 practices, and are you suggesting that there should be?
Repeat that, because I missed the beginning of that.
Have there been warnings or certifications to businesses over COVID-19 practices, and are there going to be?
Not that I'm aware of. I mean, I think there are discussions, and I know the health department and Dr. Bogan gets calls and requests for different organizations that want to get some advice on how to operate, and we'll continue to do that, whether it's a construction site, a manufacturing, retail, restaurant, public facility, all those type of things. And we'll continue to work with our experts. Secretary Levine and the health department at the state level has been a great source, as well as the CDC at the national level. So we're going to continue, and again, as you mentioned, UPMC, AHN, the folks that are out there doing a lot of the testing that are out there. We're all going to continue to work together, but the businesses and the organizations, the schools, the universities, et cetera, are going to continue to evolve in how they do things, and we're going to continue to have those discussions. So I think that's probably the best way to handle that.
This next question is from WESA. On average, how many contacts do each of the new cases have? We talked previously about the older cases having 1 or 2, but how many additional people do contact tracers or case investigators have to contact for each of these newer cases?
Yeah, that's been quite variable. So we did talk about during the sort of April, May time when people were really at home, the number of contacts was very low, really like 1 to 2 contacts per person. We're seeing a lot more variability now. We still have a lot of people who have very few contacts, and then some who have many more. So the range has expanded, and overall the average has expanded. I don't have an exact number, but we definitely have seen some increase in the number of contacts in the last couple of weeks.
And this question from KDK Radio, when you say you are planning for more cases, what do you mean? What plans does the health department have?
Well, we are planning for contact tracing and case investigation and making sure we have enough staff to be able to do that. We are constantly looking at availability of testing, who can get tested, where they can get tested, trying to be responsive to those needs. Again, and I've said this before, as we have more cases, we really need to be having more availability of testing. So for me, capacity should follow the number of cases we have, because again, you'll have more contacts and more people exposed. And so that's what I was meaning when I said that.
And this last question from Public Source, the American Red Cross is going to be testing blood donations for COVID-19 antibodies. Will this data be reported to the health department?
I don't know the answer to that. I will find out.
That was the last question. If there's any closing remarks.
Well, thank you for joining us for our weekly, and again, this week's a little different than most weeks because over the last 6 or 7 weeks, we've continued to see cases go down. This week's a little bit different. We've had a couple days now where it's been 45. And it makes a concern. It's not anything that we need to really panic as of yet, but it's one thing I think we need to keep our eye on and to take the advice that's going on. You know, we have, as we all know, in this country right now and in our community, 3 crises that are kind of happening all at the same time. One is obviously the pandemic we've been dealing with since early March. The second one is the economic impact that has occurred throughout because of the pandemic and for other factors. And then the racial tension that is happening, the racial disparities, and many of the protests that are happening around the country and around our region, and all have obviously a lot of relation to them. The economic disparity that occurs racially because of institutional racism that's happened, the incarceration rates that are not equal, et cetera, and we've seen a lot of that. And all of these things kind of converge together, but we want to make sure that we can work on all of these issues together. The health issue, the disparity issues, the racial disparity issues, as well as the economic impact issues. So a lot of it, we've got to have strategies by working together on all these areas, and we want to continue to do so. I want to thank everybody for their great level of cooperation that we have seen over these last 3 months, where people are wearing their masks, people are doing physical distancing, people are making sacrifices of not being in places where they know that they put people at risk, particularly family members, friends, co-workers, et cetera. So we want to continue to do that. Until we have a vaccine or a cure, we're going to have to continue to do this. I mentioned, I was just maybe a month or so ago, that if this was a baseball game, we're in the 2nd inning. You know, maybe we're in the 3rd inning now, I don't know. But the fact is we're still early in this long process of a marathon and not a sprint. So anyway, let's continue to stay safe. Let's continue to monitor our activities and these numbers, and thank Dr. Bogan and her team for helping to keep us safe and continue to follow their advice, her advice, and the rest of the professionals we have. Stay safe. Thank you.